The superficial muscles of the back are trapezius, rhomboid, levator scapulae, and latissimus dorsi. So let's look at these. Trapezius, I chose this model again. Its origin is on the vertebra here, coming all the way up and down the vertebra, all the way up to the base of your skull. If you reach back and feel on the back of your skull, on the posterior of the occipital bone, you will find a bump, and that is your external occipital protuberance, and that's where trapezius attaches. And it's going to come down as a trapezoid to attach to the spine of the scapula. Now, we only have half of it here, but if you were to imagine the other half, this is a big kite on your back. It's a big trapezoid. So it goes to the spine of the scapula. Its action is to shrug the shoulders. It elevates your scapula. Or if you activate the lower portion, it will pull your scapula down. And it is part of pulling your shoulders back, retracting the scapula. And its innervation is ventral rami nerves because it is a superficial muscle of the back. So therefore it gets ventral rami nerves. Levator scapulae, its name tells you what it does. Levator should sound like the word elevator. And scapulae tells you what bone it goes to. So levator scapulae means it elevates the scapula. Its origin is it is here on the cervical vertebra, and then it comes here to the scapula. Scapula is missing in this picture. It is deep to trapezius, but it is a superficial muscle. So it is levator scapula. It's going to attach to what we call the superior angle of the scapula, and it's going to elevate the scapula, which means that it's a synergist to trapezius. They work together on that raising or elevation of the scapula, shrugging your shoulders. And again, the innervation is the ventral rami nerves. The rhomboid muscles actually exist as a pair, rhomboid major and rhomboid minor, but we're going to learn them together. The origin of the rhomboid is here, about C7 and about halfway down the thoracic vertebra. It is going to come across in the shape of a rhomboid. And this line here is to represent the medial border of the scapula, which is its insertion. So it fits there. It's about the size of my hand. The action is to retract the scapula. If you've ever done anything where you've pulled back or somebody's told you shoulders back, that is the rhomboids. You can feel it. It is also a synergist to trapezius because it works with trapezius on the retraction. However, although both of these muscles are synergist to trapezius, rhomboid is not synergist to levator scapula because they don't work together. They don't work opposite each other, so they're not antagonists, but they are not synergists. But both of them are synergists to trapezius. And the innervation is the ventral rami nerves. The fourth superficial muscle of the back is latissimus dorsi. Latissimus dorsi has its origin from basically, it's slightly deep to trapezius. It basically comes all the way down the sacrum, and then it's going to go to the anterior humerus. It's the only one that goes to the humerus. If we're going to the humerus, then the action is to pull on the humerus. And we're going to pull the arm posteriorly, which is extension or hyperextension of the shoulder. And again, my innervation is the ventral rami nerves. Latissimus dorsi, because of its action of pulling the arm posteriorly, is frequently called the rowing muscle. Muscles of the chest. Deep muscles of the chest will be covered with respiration because they're all about breathing. But let's look at the superficial muscles of the chest. Again, we're going to attach axial to appendicular because it's superficial. We're going to, again, move the upper limb, either the scapula or the humerus. And again, my innervation is by ventral rami nerves. So the first superficial muscle of the chest is named serratus anterior. And it gets its name because it looks serrated like a knife, jagging in and out. Its origin is the ribs, which I've just highlighted with red. And then its insertion is on the anterior surface of the scapula on the medial edge or vertebral edge. So it goes all the way deep to the scapula bone to attach the scapula, which is how it's going to protract the scapula, which means pull it forward. So serratus anterior is an antagonist to trapezius. Trapezius and rhomboids pull the scapula back. Serratus anterior pulls the scapula forward in that protraction. It also has a role in abducting and raising the arm. Basically, think of it as the boxer's muscle, and my innervation is the ventral rami nerves. And it goes through here, and you can actually see that serration. Pectoralis major is another large chest muscle. My origin is basically anterior. It goes the medial 2/3 of the clavicle. It goes down the sternum and around the ribs, and then it is going to come and also attach to the humerus. So it's going to adduct the shoulder, and it's going to cause medial rotation. You use this muscle a lot when you do push-ups because you move from the abducted position into the flexed position, and in doing so you also have to adduct the shoulder at the same time. So this is the push-up muscle, and its innervation is the ventral rami nerves. Pectoralis minor is the third and last of the chest muscle. It is deep to pectoralis major, which is why they've taken off pectoralis major on this piece. Again, my origin is on the ribs. It's the higher ribs. So it's not down low where serratus anterior is, but you can see it comes here from the ribs. And then it's going to go to what we call the coracoid process of the scapula. And in doing so, it pulls on the scapula forward and down. So it can also work on protracting the scapula, but this is one of the muscles that we can actually move to pull the insertion and the origin separately. So if I pull the origin up, I will raise the ribs and I will help in deep breathing. And my innervation is the ventral rami nerves. Those are the deep muscles of the back, the superficial muscles of the back, and the superficial muscles of the chest.